Good afternoon. This is the one of our regular public update meetings. Today we have got Lincoln Sargent, who is the Director of Public Health for North Yorkshire County Council. Lincoln, welcome to the meeting. Lincoln is going to talk to us about the test and trace system that's coming into play, or is in play at the moment, and how that's working here in North Yorkshire. We've got Assistant Chief Constable Mike Walker, who's going to take us through the work of the Strategic Coordination Group, which is a subgroup of the Local Resilience Forum that has been managing North Yorkshire's response to the virus. And we've got Chief Constable Lisa Winwood, who's going to take us through the latest in policing and the powers and some of the issues. We've also got a number of questions, but I will come to those questions after each individual has given their update, because they may well cover off some of those questions in the updates. So, Lincoln, if it's okay, over to you, and welcome. Thank you.
Thanks. So essentially, test and trace is one of the public health measures that we use to control a pandemic. It's not necessarily new in and of itself. It's one of the approaches that we use for outbreaks. What has happened with the lockdown is that has allowed us to reset the situation in the UK back to where it was at the beginning of March. The numbers across the UK have come down to the levels where it is now possible to identify any new case, rapidly identify the people they have been in contact with, and essentially pull them out of the general circulation so they do not then pass that infection on to others. So the idea of test and trace is that every case is picked up by the National NHS Test and Trace Service. Those cases are interviewed by healthcare professionals working centrally. They will identify the contacts of those cases. Those contacts are then contacted by call handlers who are working as part of the NHS Test and Trace, and they will be instructed to self-isolate for 14 days. If a contact becomes symptomatic, then they will order a test as per usual, and then the cycle begins. You self-isolate if you're symptomatic for 7 days after you develop symptoms. So that's the basic idea of test and trace. You identify cases. If somebody has symptoms, they get a test. If they're positive, that triggers the test and trace process. Contacts are identified. Contacts self-isolate for 14 days if they remain asymptomatic. And hopefully in that way, as cases come up, you basically neutralize the ability of the virus to continue beyond those initial contacts.
So, so how does that work then at a local level, Lincoln? If all of that is done nationally, who tells what to who locally? And if, for example, we did get an outbreak locally, say, I don't know, in Northallerton, what would we do locally to deal with that outbreak?
So some good points. Now, what happens is that a number of cases and contacts may be considered complex or kind of high risk, because let's say, for example, a case developed in a care home or in a school setting or in let's say, a homeless hostel, for example. There are particular settings that are of high risk because of the impact to the people or to the fact that those settings may lend to easier spread. If those things are triggered in the national system, they're then escalated to the local health protection team, which is a part of Public Health England. And they will typically work with us because very often we have a lot of local information. We know what's going on the ground, and very often they will link with us to make those connections. But they will then do the contact tracing in those complex situations. Occasionally, you may then have somebody who needs practical support. So let's say somebody who lives alone needs to self-isolate for 14 days, but needs support with shopping or to collect medications, those kinds of stuff, then that's a role that we have in the county council to provide that practical support. The other things that we're looking at is issues around if people are self-employed, what can we do with partners and others to support them financially if there are issues where children are in school, for example, and their parents are self-isolating, what are the implications? So those are some of the kinds of local support things that we need to put in place to allow contacts to be able to self-isolate and any cases that we have that need that additional support locally. So that would be what happens in local instances, single cases, single contacts. Occasionally, we have situations where we may have multiple contacts in a setting, and what we've been dealing with most recently is care homes. So where we have maybe a number of staff who are positive, a number of residents in the care home who are positive. And then in that situation, what we try to do is to prevent onward spread from that care home. We do a mini lockdown, if we want to use that terminology. So we try and ensure that there is no movement in and out of that care home until we have the situation under control. Part of what we do sometimes is to test the whole setting, because we know that a number of cases may not develop symptoms in the classical way. And so we try to pick up all the cases that we can. And within a care home setting, we segregate the cases from those who are free of infection, and we ensure that we keep the positive cases separate from the others so that you then don't have that cross spread within that setting. If we do those things well, that's probably going to be the pattern that we see in terms of COVID-19. Should the rare occasion occur where you have more widespread cases. So, for example, if we got information, I think, did you mention Northallerton that we wanted to pick up? If we had a situation where we had lots of cases in Northallerton that were not confined to a setting, and in order to control that, we had to do something like restrict movement in and out of an area and ask people in an area, whether the whole town or part of the town, to remain isolated for a period, typically 14 days, maybe 14 to 28 days, in order for us to prevent and interrupt any further spread, then we would be dealing with the kind of localized lockdown that has been a lot discussed in the press. And that clearly has challenges about how do you do that. Lots of people will consent to that. They will certainly, most people are reasonable if they understand the reasons, but then there are implications in terms of local business, the reputation of the place, what happens with schools, what happens with healthcare facilities if you have to close down. How do you police and the whole issues about even if residents are happy to remain indoors for that period, how do you police movement in and out from visitors, for example? And what are the powers to do that? So there are lots of, as yet unresolved, about the practicalities about how you actually do that if you got to that stage.
So it seems to me then that we've had quite a lot of focus, or certainly, I mean, it's certainly what the world I've been involved in is around the sort of policing these things. But actually, what we really need here, and I think this has happened in other countries, is people to take responsibility for their own behaviour and for not spreading the virus. And of course, we've seen people largely stick to the rules that the government has imposed. But really, this is a new ask, really, of people, isn't it? Because we've got to do this ourselves.
Yeah, and that's the whole point. I mean, the virus depends on us to spread. Yeah. So I think it's something about, I know we have, as governments have to try and make rules to simplify so that people understand easily what to do. But you almost have to go back and ask, what opportunity is the virus seeking here? and act accordingly. So test and trace becomes really important, because if we don't have a situation where people act quickly, and I know, you can think about a small business that might think, well, a lot of my members of staff may need to go off, what happens for 2 weeks? But if we don't take rapid control, that can then escalate, and you still have the same situation happening later on. So I think it's so important that people recognize swift action is necessary. We can confine the impacts if we are able to identify and act quickly. And that does require us, one, to think about who our contacts are, because one of the implications in the near future is if we become symptomatic, have a test and are positive, the next question that will be asked in the approximate 2 to 3 days before you had symptoms to about 7 days after, which is kind of key period when you are infectious to others, who have you been in contact with? And that becomes really interesting. So if you're not kind of following the rules and you're out with lots of people, then that creates a nightmare, because it's the super spreaders. We know that a lot of the infection is linked to individuals who have lots of contacts. Most people probably have 1 or 2 household contacts. That's easy enough. But it's a situation when you're out and you're meeting with lots of mates, and they then meet with their mates, that you could quickly have a situation where one infection multiplies into tens and hundreds fairly quickly.
So I mean, that's interesting. That leads us into one of the questions I think that we've had from members of the public, and this has been a theme, I would say, during these update meetings, and that is, the behaviour of young people. I mean, I think young people, this has been really difficult for young people.
Missing you a little bit, Julia.
In York, but also, sorry,
you froze a little bit. You were talking about young people. Just repeat that last bit.
Yeah, so it's my broadband connection, rural broadband, not always brilliant. So yeah, so concerns really around young people congregating and not social distancing. What would your message be, really, Lincoln?
Yeah, so I think it's really important, because bottom line is the risk to young people, if they become infected, of developing severe illness is actually quite low. And I think a lot of young people think, well, I don't have much to lose if I meet up with large groups of mates and hang out and do what teenagers do. The concern I have is then unknowingly, unwittingly, you may then take that home. And through just interactions that families have with each other, you or your mates may then lose their nan, yeah, or somebody in another household who has an underlying health condition, whether they have cancer or diabetes or heart disease or whatever, and suddenly you lose a loved one, yeah. And that's the kind of stuff. So it's encouraging young people, yes, have fun, but you have to think about the virus is looking to hitch a ride, yeah? And it is looking for precisely those kinds of interactions that allow it to spread rapidly to a large number of people and their households. So it's never about just who you're meeting. It's about who are they then meeting, who are their household contacts, and the household contacts of those contacts. That's the kind of thing we have to begin thinking about.
So we've had lots of really sort of clear messages from the government. So stay at home, protect the NHS, stay alert. We're moving into a sort of new phase of all of this, and it looks like the sort of management of outbreaks is being devolved down to a local level, which to control the spread of the virus. Do you, what's your message to, I mean, should we still, obviously there are rules in place still around how many people we can meet with and the circumstances in which we can meet them. It's quite easy as we see the shops opening and things relaxing a little bit to forget about some of these things.
Yeah, and I think clearly as the number of cases generally falls, the kind of background risk decreases. So I think the number of cases in the UK has been coming down steadily. It's often interesting to remember that back in the end of February, March, the whole UK pandemic, which has now claimed over 41,000 lives, started with a seeding of 1,300 cases into the UK. Multiple cases coming in from Italy. I think Italy, Germany, Spain, France were probably the main importations, but Italy certainly the first wave. And if you think about 13 cases being able to rapidly multiply in a matter of a few short weeks into the situation that we had, we probably have in the UK more than 13,000. Sorry, not 13. We probably now have more than 1,300 new cases a day. I mean, certainly that's the kind of numbers that are being reported through nationally. So the potential that we could lose control of this is not exaggerating. Yeah. And the way to do that is to balance very carefully the need to get on with life, but also to remember we're now living with this new infection. And not, so to summarize that, I think it would be a mistake for us to believe it's all over and we're back to normal. Yeah. We have to constantly ask ourselves, am I giving this virus an opportunity here? What do I do to live life as normal as I can, but not give the virus an opening?
And Lincoln, in terms of the planning that you're doing as a Director of Public Health, how long do you think this is going to go on for?
So best guess, so we will probably need to get to the winter. And I think most of us who are in public health and healthcare, what happens and how this virus behaves over winter is going to be really interesting, because it comes from a family of viruses that surge in winter. It's one of the cold viruses, basically. So working through into winter is going to be our first kind of key milestone. I've said to people, I want to see 2 winters and then I can breathe. So initially our plan is certainly 12 to 18 months as how we deal with this in the next phase. And then we will see what the virus does kind of in the long term. We live with other dangerous things. I mean, people forget about tuberculosis. I mean, yes, we have some treatment, but, tuberculosis is a very nasty infection that we live with, and we coexist. The other thing that could be a game changer with COVID-19 is, of course, if we get a vaccine. And then that changes the response to some extent. But if we do not get a vaccine, then we will have to do this kind of cautiously, look for infections, localized outbreaks, deal with them aggressively, and that will be business as usual, I think, for at least the next 12 to 18 months.
Thank you. Does anybody else have any other questions for Lincoln?
Yes, if I can, just quickly,
No.
just to talk about. Just to quickly, Lincoln. There's questions from the public about the use of face coverings and the suitability of face coverings. Do you have any thoughts about whether people should be proactively using face coverings in public, please?
Yeah. So the kind of mainstays of how we control the infection are, first of all, about maintaining social distancing as much as we can, proper hand hygiene, not touching the face, all of those messages remain relevant. But we recognize that there will be some situations where it is difficult to maintain social distancing. So when you are in an enclosed space, you're indoors. So public transport is a classic example. Probably, I know the supermarkets are doing quite a lot to do social distancing, but some of the smaller shops that may be more challenging, etc. Then having a face covering does decrease the potential of you passing it on to others. The main issue here is not necessarily protecting yourself. It is you decrease the chances that you could infect others. And I think that if people then use face coverings in those kinds of settings, you reduce the risk of transmission person to person. Does that answer?
Yes, Lincoln, I'm having difficulty with my broadband today. So I think there is a distinction, isn't there, between a face covering and a face mask as well?
Yes. So certainly I deliberately use face covering because I think the surgical grade face masks, of course, offer a much more effective barrier. What we don't want, however, is that demand goes up for surgical masks and then takes away the supply from health and social care settings where we absolutely need those face masks for people to be able to do their day-to-day work of caring.
Thank you. Will, you've got a question. You've got your hand up.
Yeah, hi. I'm just making sure I'm off mute. Can you hear me? Yeah. Lincoln, I don't know if this is a question you can answer locally or if it's a feature of the system which needs managing nationally, but there are concerns around confidentiality for some people, like domestic abuse victims, and how the track and trace system needs to be flexible in that regard. Can you talk about that a little?
Yeah, so clearly it's difficult because I've not seen the kind of internal protocols of NHS test and trace. I know, from my own practice of doing contact tracing in other illnesses and so forth, confidentiality and the confidence is quite key with that. And I think we're typically able to give people those assurances that the information we shared will be kept confidential. Clearly, there are going to be some situations where, and our colleagues, for example, who do contact tracing around sexually transmitted infections, will have a lot of, experience with this, because clearly, by definition, who the contact is. So I think that there is usually something about balancing the risk to individual and public health against the risks that might be posed by domestic violence. And I think this is one of the reasons where something like that would be escalated to the local health protection team, for example, because you do require kind of experience and nuance to do that kind of balance. And I think if you kind of do a risk assessment of the situation, there will be some situations where you balance the risk and you think it is better to warn and inform as opposed to try and do the contact tracing. But I would say a lot of it will be an individual situation and working through the individual case and what is best, both for the individual's well-being and for the public health needs.
The issue I fear, though, is that, you just might not know you're talking to somebody who is days of close proximity with somebody who's abusing them. And so, one of the things I think that we're concerned about is also, can we use the test and trace system to make sure that, services for domestic abuse survivors and victims are known about, and people would know where to get help, but also people might not just want to reveal where they've been or who they've been with, particularly if they're in a coercive and controlling relationship, and that in itself could present further risks as well. So this whole area is fraught with risks and difficulties, I think. Yeah,
I agree, and it's difficult to say what the answer is in each case. I know certainly you have experienced people who will have a nuance and a way of approaching these things, but we do try and make sure that we balance the situation as much as possible. And yes, there will be people who will not be able to to put forward their contacts. I mean, nationally, those of you who have been following the kind of report of the kind of first week of NHS Test and Trace will know that the follow-up of contacts hasn't been 100%. Indeed, the follow-up of cases, I think, was about 2/3. And I'm sure it's situations like the one that you mentioned, Julia, that will account for some of that gap.
Thanks, Lincoln.
Yeah.
I think Julie's frozen, but appreciate that. Thank you.
And I'm conscious that I've got a terrible broadband connection today, and I'm wondering, Will, whether it might be possible to hand over to you.
I was just about to step in, Julia. I was giving you just a few seconds to end.
The quality of Will, can you share this from now on, please? My broadband's just not working. Lincoln, can I say thank you?
Thank you so much.
Thank you very much.
Lincoln, you're welcome to stay, but you're free to go if you've got other things. I know you're a busy man.
Okay, thank you so much. Do enjoy. Have a good one. Bye now.
Mike, I think it's over to you then as an LRF update, please.
Yes, good afternoon. I'll give a quick précis of where we are with the local resilience forum and what strategic risks we're currently looking at, and then help out with any questions that you may have that we need answering. So since the start of March, obviously a major incident was declared nationally, but a major incident was declared within North Yorkshire and the city of York. And in terms of for the pandemic, and in terms of the local resilience forum response to that, at that time, as a response to major and critical incidents, we have an obligation then to co-locate and have a joint understanding of risk to ensure that we deal with the various different issues that have come out of the pandemic collectively as various different agencies. My role within that, yes, I am the police gold for the North Yorkshire Police COVID response, but I am the chair of the strategic coordination group. We have operational levels, tactical levels and strategic levels. So my role is to chair that group and organise and work with all the partners to ensure that we're meeting the aim of supporting public health colleagues. So since the start of March and running into April, we've had regular strategic coordination group meetings and more regular tactical coordination group meetings where various different problems several times a week are dealt with, and various different partners go away and carry out different actions. What we've had set up as well is a multi-agency coordination centre down at North Allerton, so that at least 5 days a week with skeleton staffing on a weekend, they are continually dealing with the various different issues that have arisen since the start of March and since the start of the pandemic. And more recently, over the last few weeks, the strategic risks that we've been focusing on, which have then run all the way down to the operational level, have been NHS demand management, which clearly from the start, where we needed to and still need to protect the NHS, one of the focuses was to ensure that we didn't clog the NHS system up, because that would have meant more lives would have been lost through the pandemic. So that's something we're still looking at in terms of demand management, because as the NHS move forward into their next phases, phase 2 and then phase 3 into the winter, we need to ensure that we're still giving them that support and that nothing's causing an issue in terms of the capacity and hospital bed capacity within all our NHS locations across the county and the city. The second risk has been care home management, so that's ensuring that care homes uphold the Care Act across the county and the city. An awful lot of incredible hard work done by Lincoln Sargent and Sharon Stoltz within York City Council to ensure that there's a real good wraparound for care homes, a daily support mechanism to help with PPE and any other potential problems with outbreaks within their care homes. So that's something that we still acutely work on a daily basis. The third risk is the PPE across personal protective equipment across all agencies. Very briefly, we have a PPE panel on a daily basis where people bid in for a plethora of resources, and we send them out to make sure that there is personal protective equipment across all different agencies and locations, doctor surgeries, care homes, etc. The fourth risk that's been continual has been testing. So that started with key worker testing, mobile testing units, onto the testing of the public. Largely in North Yorkshire, we've been dealing with various different mobile testing units. We've had a regional testing centre at York as well, but we've also been using testing centres in West Yorkshire and in Cleveland as well. And there's good capacity within those testing stations. The last risk that's we've been really focusing on over the last few weeks is care home testing, to ensure that we get the appropriate testing within all the 260 plus care homes across North Yorkshire and the City of York. I am pleased to say that we have a real good mechanism now in place. We've got a satellite testing site now set up at the coast, which has already had 1,500 tests delivered to it this week. And logistically, between the Fire Service and North Yorkshire County Council and other partners, we will deliver those tests to care homes, bring them back and get them processed as quickly as possible. We've already seen a number of deaths in care homes across the county and the city, and we need to do what we can to protect some of the most vulnerable people within our communities. But I'm content now as SCG chair that we've got a good process in place for that. So just as rounding it up, really, it's important to say that we have been pretty busy, as we know, since the start of March as a local resilience forum. We are still in the response phase of COVID. The virus is still out there, and Lincoln's really explained that very well. Test and trace has now come in. It's coming because we know the virus is out there, but we want to be on the front foot, ensuring that we can manage any local outbreaks. We will be in the response phase for some time, but we're also looking at doing some recovery work as well. There's a lot of businesses, a lot of the public who are starting to go back to some new normality, and they need support in doing that. So the response phase and the recovery phase from North Yorkshire County Council, from the York City Council, will run in parallel. The police and all the other core agencies will be involved with that. But we've got a lot of hard work to do still. But we're maintaining that drive to try and keep people safe. And that's a bit of an update so far from the LRF.
Thanks, Mike. I know you can't necessarily speak on behalf of health colleagues, but you talked about protecting the NHS at the beginning, and there now seems to be more capacity than there was. And I know we're concerned there might be people who are being poorly at home and haven't felt able or reassured enough to go to doctors or hospitals. And if there is, as far as you're aware, capacity to kind of better support those people now and encourage them to come out and visit their health support workers, whatever they may be.
Yes, and NHS colleagues are doing an incredible amount of planning to understand what the issues currently are out there in the community and what that will look like moving forward when people do present themselves. But yeah, absolutely, people need to be talking to the GPs. People that are unsure need to be ringing 101 if they have. And when they're not talking about COVID symptoms, I think what you're getting at is other symptoms that people need to be presenting with. That's definitely what the NHS want people to do. They want to encourage people who feel as though they need that potentially acute medical care to get in contact. So yes, on behalf of the LRF, I'd encourage those people to be in contact with their GPs, call 101. Obviously, in emergencies, there's still A&Es open across the county as well. But absolutely, people should not be suffering at home.
Thanks. And on testing, Mike, you mentioned a satellite testing site in Scarborough, taking lots of tests, which is excellent. Does that cover the whole patch then?
Really good question. Well, it doesn't. It covers the east of the county at the moment. But a bid has just been in. An application has gone in for a satellite site at York, and also an application has gone in for a satellite site at Harrogate. This time next week, both of those should be up and running. So across our 3,300 square miles, we will get the coverage we need. It's really fair to say on that point as well that the Local Resilience Forum and all of the partners have been quite robust to ensure that we do get the right testing facility for care homes across North Yorkshire and the City of York. And there's a credit to many people down at North Yorkshire County Council and the City of York and other colleagues for getting where they've got to at this point to ensure that we get the care homes tested in the appropriate way. We will keep it as a strategic risk, and we'll keep focusing on it to make sure that we do the right thing.
Thanks, Mike. And then as a general sort of update for the public, what are infections and deaths like? Are we seeing the reduction in North Yorkshire and York as we are across the country? Do we get any sort of, there's always a question about the R rate and how that is different in different parts of the country. Anything around those two things?
Yeah, so I mean, in terms of the cases, we have been in a plateau for a number of weeks. and we are seeing a decrease in the number of infections across North Yorkshire and the City of York. And it's the same in terms of the number of deaths. We've had 249 deaths in hospitals so far across the county, and 188 in care homes. Those numbers have been in a decrease from the plateau, and with the number of virus cases going in the same direction, it may not be going decreasing as fast as other parts of the country, but it is going in the direction we would expect it to do. But the virus is still there. That's the key point. The virus is still there. There are still restrictions in place around gatherings, around staying overnight in locations. So, you know, from the public, what I would ask from the public's point of view is that we are nowhere near back to a normality here. There are still restrictions in place. Everyone needs to ensure they're fully up to date in terms of what those restrictions are, but also what the reasonable excuses are, for example, of travelling to different places. And there are reasonable excuses for staying overnight as well, but people need to really understand those. We know that the restrictions are going to be lifted on a gradual basis, and people need to really keep a close eye on that, on the news, on the gov.uk website, to ensure that they really know what they are and aren't allowed to do, because that virus is still there.
Thanks, Mike. There's two public questions about that, which shows the difference of opinion potentially. One is around when the public can start doing overnight stays at their holiday homes, which is a bigger issue in North Yorkshire than maybe elsewhere, with all our beauty spots and coast, etc. And the other is what policing and partners are doing to block sites that may have overnight visitors that maybe don't have a good reason to be there, or a reason that's loose, as you might say. Are the LRF sort of across those issues?
Yes, I mean, because clearly it's not the police's job to block entry to somewhere in those circumstances that you're describing. But yes, the Local Resilience Forum are working collectively. All local authorities are represented on that Local Resilience Forum. Since the lockdown restrictions were reduced, local authorities have had to respond really quickly around opening car parks and toilets and other facilities. As the lockdown restrictions keep being lifted, so I would imagine at some point over the next few weeks, the overnight stays issue, potentially around camper vans, may be changed, and campsites may be opened. That hasn't happened yet, though. But when it is, this is not a police-led operation. Most of the work needs to be done by those local authorities who have those sites and the particular problems within their location. So yes, as things are lifted, the Local Resilience Forum has a grip in terms of that, and we obviously work with local authorities partners to try and assist them where we can, to try and release the burden, because we have some areas at the coast and the like where people do tend to flood to, and we've seen that throughout lockdown period. We expect that to continue, so yeah, we'll work in partnership to assist each other.
Thanks, Mike. One more question from me, and then another from the public. One is, given you've mentioned the gradual easing, which is government led, of course, but have we seen any change in infection rates and the gradual easing, and any concerns around increase? You mentioned plateau and decrease, but I'm just conscious that we might be about the time where the changes might have started to take effect in terms of infection rates or anything, but it doesn't sound like that's the case.
So no, a really good question as well. So that's something from a Local Resilience Forum that we're obviously monitoring on a continual daily basis. We know that there was a concern from the VE Day celebrations that there may be, 2 weeks after that, we may start to see a spike in cases. North Yorkshire hasn't seen that. We know at the moment, in terms of the Black Lives Matter movement and some of the protests that are happening around the country and locally across North Yorkshire and the City of York, so we've had quite a few protests. There's obvious concerns that those people coming together may spread the virus as well. So we're keeping a really close eye on that from a Local Resilience Forum point of view. Lincoln Sargent and his colleagues are keeping a really close eye on it as well, so that if we see a particular issue in a particular location, people presenting at a hospital, we can really focus on it. Work with Public Health England colleagues as well, nationally, and see what we can do, because that's when the potential local lockdowns will have to be implemented, which will be localised, but we need the support of Public Health England colleagues with that as well.
Okay, thanks, Mike. Last public question, Mike, which is a really good one actually, which is around key support for key workers. So far, childcare and schools have remained open as far as they're able to for key workers. Is there going to be a sort of change in availability of those resources as schools close for the summer as they would normally, or there are plans around continued childcare and schools for key workers?
Again, that's something that the local resilience forum schools is one of the areas that we do focus on, because obviously we have so far to give the support to those key workers across North Yorkshire and the City of York, and the schools have been incredible in relation to what they've done to support the key workers across the county and the city. Moving forward into the summer holidays, you know, as a parent myself, I would normally have some form of plans in place, but some of those plans are sometimes clubs at these particular schools, whether it's, you know, indoor activity or outdoor activity. It's something that the schools are working with other partners on at the moment, and that all parents will be looking at to ensure that the 6 weeks or so summer holidays are covered off so people can still come to work, but it obviously still enjoy some time with the children. So yes, obviously some of the schools will close over the summer holidays. It may be possible that some of the schools will do something different because of the COVID-19 outbreak. I haven't got the particular detail on that, but definitely everybody from, you know, from a parent point of view will be, and there will be some anxieties around that to ensure that people can still come to work. But you know, all the key workers, employers need to be given that support as well.
Okay, thanks. I think that's that then for the LRF update, Mike, unless, Julie, you can hear us and chip in if you need to. No, I don't think so.
No, I think that's fine. I think that's no problem. Obviously, we've got some specifics around policing. So, Mike, thank you very much, and apologies that my broadband has curtailed my participation somewhat in this, but thank you for yours.
Great. So, Lisa, over to you then for a more policing focused update, please.
Yes, thanks very much. So we've still got.
Oh, Lisa's just left the conversation. We'll give her a minute to come back. Mike, this might be a double header for you potentially. We'll give Lisa a minute to come back.
That was well planned, wasn't it? That was very well planned.
Can you give us, just until Lisa comes back, a bit of an overview of policing in North Yorkshire at the moment?
Yeah, of course I can. Absolutely. You know, from a policing point of view, we are in a different world at the moment in terms of heading back into some form of new normality. What I can say is some of the normal policing that we've you know, historically always carried out has increased again as we've seen the lockdown, the restrictions ease, more people on the roads, more people out and about. Unfortunately, more of some of the traditional crime, the crime that goes on online has continued, and we will continue to fight that crime against some of the most vulnerable out there. And you know, North Yorkshire Police, and I mean everybody in North Yorkshire Police, has shown immense commitment through this period. And a lot of drive and a lot of enthusiasm to help public health colleagues, but also to protect the communities of North Yorkshire. And we'll continue to do that moving forward. If there are further spikes of the virus across the county, we again, if we have to go back to more enforcement, we will again work with colleagues around that. But you know, so far, the North Yorkshire Police colleagues have done a tremendous job engaging with people, explaining what the restrictions have been, encouraging, but also unfortunately having to enforce where we've needed to. Our officers on the ground have engaged with thousands and thousands of people travelling across the county, travelling into the county, which is probably one of the reasons why up to last week North Yorkshire Police had issued more fixed penalty notices than any other force in the country. Now, North Yorkshire Police is vast in its size, but you know, quite a small workforce of police officers, around 1,500. What that has demonstrated is that we've shown really good visibility out there within communities, both urban, both rural, and we've been willing to stop and engage with people. And unfortunately, sometimes have had to enforce the COVID-19 regulations. But at this point, we have started to reduce the number of fixed penalty notices that we've issued. Obviously, it's only been a small minority previously, that have thought that didn't apply to them. But luckily, I think people are starting to listen a little bit more. There are more reasonable excuses for people being out and about. But let me firmly say that we are still responding to gatherings of more than 6 people at the moment. We are still responding to reports from members of the public, which I think the public would expect us absolutely to do. And we are still engaging with those people in those circumstances who may be gathered when they shouldn't be. They may be staying overnight in places where they shouldn't. So, yeah, absolutely, we're still involved in the policing the COVID regulations, but very much back to normal policing, tackling crime on the roads, tackling crime online, looking after the most vulnerable. And we've still maintained a really low absence rate. We haven't had our full training ongoing. So we've been able to be out and about, and the officers are still very much driven to be there for the public of North Yorkshire.
Thanks, Mike. Welcome back, Lisa. Mike,
Thank you. Apologies, my technology kicked me out, but I'm back in on the web, so fingers crossed that my internet stays off.
Mike's given an update. You'll have caught the end of that. I'll sort of ask some open questions, which either of you can answer really. So, Mike, it's kind of it sounds a bit from what you said like it's in between business as usual and sort of COVID-19 focus. Are the public going to start seeing less police officers on the sort of in communities as they start to pick up investigations and other crimes again, or will that visibility remain sort of as it is for the foreseeable?
So really good question, and I know there is some concerns, especially in some of the rural communities, that there has been a really good police presence there, and the worry is that there'll be a gradual withdrawal. Obviously, and there are times where demand does outweigh some of the resource that we have. However, our job and the commander's jobs is to ensure there are patrol strategies out and about amongst all their communities, so that people still feel reassured by the police presence in that area. It isn't just a withdrawal to say, well, actually now in certain locations, because there are reasonable excuses to go there, that we should just remove all police resource, and we're not doing that. So the public still should see a good police presence from police officers, PCSOs, volunteers, special constables out across the county and across the city. Clearly, I mean, we're dealing with Black Lives Matters related protests and counter protests that have increased over the last 2 weeks in North Yorkshire. But we've policed those on a really proportionate and necessary scale to ensure that we aren't drawing all the resources in just to deal with those protests. They've been very peaceful protests anyway, in the main. But we will ensure that we balance resources across the force. We always do that. We have to do that whenever we deal with really big operations. We can't just pull all resources into one particular location and leave somewhere else without any policing. And we've never done that. We won't do that. It's particularly acute at this time through COVID. That North Yorkshire Police has done a really, really good job, I think, of showing a presence in the communities and responding to the concerns of the communities. And it's our aim to continue doing that moving forward.
Thank you. This is a sort of technical question, but I'll try and make it tangible to the public, which is, you've mentioned sort of having to sort of drop non-urgent things like some parts of training, and I imagine things like leave have maybe been harder to come by. Is there going to be a sort of resource and visibility issue down the line at some point when people start having to go on training and take their leave that might have backed up and issues like that?
Okay, yeah, another great point. So this is something that nationally and certainly locally in North Yorkshire we identified as a potential risk right at the start of this. So if we talk about training, so for example, driver training, officer safety training were some of the things that we had to postpone slightly for 4 or 5 weeks, but driver training is fully operational again. We're starting to do officer safety training again. We've continued to train all of our new recruits. There's a national push to recruit 20,000 new police officers. That's not been impacted. We've still continued to move forward, having obviously precautions in place to make sure we're not spreading the virus as well. Taser training is a really good example there of we've committed to training more taser trained officers. We've just in the last few weeks trained up to I think it's about 38 new officers, and considering we only had around the 200 mark anyway, that's a really brilliant achievement that through this time we've been able to focus on training more taser officers to have that operational capability on the front line. So training's almost back to normal, which is really good. A little bit of a lag that we need to get caught up on, but again, really committed training teams there that'll get through that and continue to progress forwards. And in terms of the annual leave, we've not had to put a leave ban in, which the police normally do when there's a particular major incident. We've never done that. We've never stopped people taking their leave. Critically, at this time, it's really important that our workforce, for their welfare and well-being, get some time off as well. I know I had a week off the other week. There's nowhere to go, but it's brilliant being off work and not having that worry. And we're really encouraging our workforce to continue to take the leave. I guess I know it's different, there's nowhere to go, but you've got to look after your mental well-being especially, and your physical well-being as well. So we're really encouraging that. We're keeping a close eye on what leave people accrue. There is a small element. I seem to have frozen on the screen. Can you still hear me?
Yeah.
What a horrible picture that is. Oh, we're back to normal. We're keeping a close eye on what people carry over in terms of the leave, being fair to the employees of the workforce, but really making sure that come February, March next year, we've not got lots of people trying to take leave really, really quickly, because it draws resources from the front line. So I've got a team, a logistics team, looking at that and trying to mitigate that risk as much as possible.
Thank you. I'm afraid it's one more question along a similar theme, but it's meant to be more about sort of health and well-being rather than visibility. But testing of key workers has been quite good for a long time, but are there risks around large swathes of officers and staff sort of being wiped out in one go now? Track and trace is sort of expanding, and there might be a case in a team that then means, you've got 7-8 staff sort of all isolating at home.
So again, what I can say in terms of that was again a risk that nationally policing identified when the test, track and trace was initially spoken about and the projections put in place. We are just finalising what it looks like in terms of what that impact will be like on North Yorkshire Police. But there are also other areas and other organisations and industries that it could affect just as much as the police. So all of those organisations, whether it's the fire service, it might be a power station, whatever it may be, are ensuring that they have a really local plan of what it looks like. So if you have somebody who's got the symptoms and they do test positive, clearly that then clicks into the national system. But from a policing point of view, and you've got to obviously think about various different issues, but what we don't want to do is then take a full shift out because of those particular issues. So it will be a very common sense approach to how we then track and how we trace where that person may have been. But we're still finalising our plans. We're very cognizant that it could, in theory, when you look at it in black and white, mean that you take a full shift out or a particular team out. Obviously, we don't want that to happen. So we will make sure we're very sensible in terms of how we deploy test, track and trace within the police, but also other organisations as well. It's something that the Local Resilience Forum are fully aware of, and we're working in collaboration around what the impacts may be on that.
Thank you. I'll turn to a couple more practical issues then. So 2 questions from the public. One, I think, has been in the national spotlight as well, which is the question really around littering and young people, not social distancing, but to take it to a sort of extreme. We've seen raves and big gatherings elsewhere in the country. And I just wondered, what preventative measures policing can take around those kinds of gatherings, and then what you can do while they're ongoing and afterwards.
Okay, so yes, there has been a couple of quite high-profile raves over the weekend with large numbers of people attending. It's something, in North Yorkshire we have had some issues with gatherings and raves in some of the rural locations over the recent years. I can remember some in the Craven area. What we closely do is monitor the intelligence, whether it's on social media or whether it's local intelligence or whether it's intelligence from another particular force around whether it's an organiser or groups of young people who are planning on travelling to a particular location. We can then obviously use our policing powers around illegal raids and such like that. It's key to get in there right at the start. So this is why intelligence is really, really important to stop people gathering. But we haven't had any issues as yet within the North Yorkshire area over the COVID period, but we are cognizant that it could be a potential issue, especially when in Greater Manchester area they've got some sort of, where it's not too far away from our borders. We need to really be making sure that we monitor the intelligence and react to it accordingly. We can use the COVID powers, as we know. We can direct young people to leave as well, because this is one of the particular problems that we've had in young teenagers gathering together in groups of more than 6, is that, yeah, we do have powers under COVID to get those people to return home, and we do have powers also to deal with the parents as well, and we are still responding to groups of teenagers meeting together. The litter issue is something that the Local Resilience Forum are aware of and local authorities are aware of as well, and we just ask people, in whatever circumstance, is that you take your rubbish home with you and you look after the place that you're actually at. But yeah, there have been particular issues with young people around the country. It's something that we're aware of in North Yorkshire and we'll react to accordingly.
One follow-up question, then another one, but keeping an eye on time, we don't have long left. On the follow-up to that, if the public see something that they think might be like that, a rave or a party or something, what is it? Is it 101 they should call?
It is, yeah. It's a 101 call, or if any local officers around. But definitely, you ring the police control room at 101 and let us know what's happening, and we will respond to that accordingly. But we ask for community intelligence to come in. The communities of North Yorkshire are really good at sharing information and intelligence with us. But if it is something that's spontaneously happening, then ring us on 101. Yes, please.
Thank you. And then the last question, which we've seen a lot of over the last few weeks, and I know this is not news to you, but I'm asking the question anyway. A real increase in scale and concern for dangerous driving, motorcycles, loud cars, all those kinds of antisocial, dangerous use of the roads across the patch, really, but particularly rural areas in the Dales. What policing is doing to try and sort of manage those kinds of risks.
Okay, yeah, and I know a real issue across some of the communities across North Yorkshire since the restrictions were lifted. We're working in partnership. It's not just down for the police to try and deal with these particular issues. We will deal with potential issues of what we call construction and use in potential illegal exhausts and such issues around the noise coming from cars and motorcycles. But what we work is in partnership through the 95 Alive work that we do with various different partners, including fire service, local authorities, and some other people who try and keep the road users safe within North Yorkshire. Excess speed of motorcycles and cars has been a particular issue across the time when we've been on lockdown. We have continued to use our safety camera vans. We have increased the presence of safety camera vans in response to complaints from members of the public and what we've witnessed ourselves. We place those safety camera vans on some of our most dangerous routes where we've killed and seriously injured occurrences happen, and we will continue to do that. We are, as much as we can, be out in force, especially at the weekends, where we just see an increase of people using the roads for leisure activities rather than travelling to and from work. And we do need to clamp down on the excess speeds, absolutely, but we do work in partnership around that as well. But again, we still expect the public to tell us when there are particularly dangerous issues happening within their community, and we'll respond to that as best we can accordingly.
Thanks, Mike. And I'll plug, as a last thing, Operation Spartan, which for members of the public watching is a police-led system that allows you to send video footage effectively of driving, might be a dash cam or anything else, but lets the police take action if necessary and if there's something on that footage which is dangerous for some kind or another. So do Google Operation Spartan and you can send that footage in. Thanks all, and I'm sure the public would encourage much as that activity as possible, Mike and Lisa, if that's not already understood. I think that's it. We've had no further questions through the meeting. So Julie, you might be able to round things off for us. Your picture is certainly clearer, so I don't know if your broadband's improved, but I think that's that.
Okay, so thank you. It comes and goes, but anyway, so thank you, Mike and Lisa. Your contributions are much appreciated. I think we are just moving into a new phase of all of this at the minute. Feels very much so, and that us in local areas are going to have sort of more responsibility for how we manage this pandemic going forwards, and try and find a way to live with the virus and to prevent it wreaking havoc. I think also we've decided to change this to a monthly meeting from now on. If something crops up that means we need to have it more frequently, then I'm sure that might be possible. But from now on, we will go back to monthly, and we will be reinstating the original public accountability meeting, which is a more formal meeting around my scrutiny function in this role. So I'd just like to say thank you, Mike, and thank you, Lisa, for all of your
contributions, I think Julie was about to say, and the efforts of everyone. I think it's been from policing, which we get to see up close and personal, an amazing response. So thank you very much. But ditto to all the partners you work with, and the Local Resilience Forum, and those who are working day in, day out to sort of keep us all safe. Also, thanks to the public on this particular meeting we've had for a few weeks, because their questions have been really helpful and insightful, and have given us an insight into sort of how it's feeling in communities. So that's been really good as well. But I'll round off. Thank you very much. Appreciate all your efforts, and we'll now see you in a month's time rather than a week's time. Thanks all.